You're all aware that we are confronted by an extraordinary situation arising out of the spread of the novel coronavirus and the COVID-19 pandemic. We have been briefing you from time to time on the challenges posed by this unprecedented situation and the steps being taken by all of us to confront this. We are here to brief you today about certain further developments in this direction. As of this moment, the total number of cases in Jammu and Kashmir is 380, out of which the total number of active cases is 294. 256 of these are in the Kashmir division and 38 of these are in the Jammu division. There have been 81 recoveries so far, and as you are aware, these recoveries include young children, and we also have had 5 unfortunate deaths. 60,000 people have been enlisted for surveillance, out of which nearly 35,000 people have already completed the mandatory 28-day period of surveillance. If I will just take a minute to take you through what the situation was yesterday and what the situation is today. Yesterday we had 368 total cases, 292 active cases. Today we have 380 total cases, 294 active cases. So while we have had 12 cases added, we also have had 10 recoveries happening. While there were 251 active cases in Kashmir yesterday, today there are 256 active cases. Similarly, while there were 41 active cases in Jammu yesterday, today there are 38 active cases. One more thing, for the first time we have had an active case discovered in Kathua today. So, no place in that sense is immune and every place has to watch out. Based on the results that we have been receiving about the number of active cases and other parameters, 5 districts, Bandipur, Baramulla, Kupwara, Srinagar and Jammu have been identified as hotspots in Jammu and Kashmir. You are all aware that we give you daily district-wise details of cases, and those of you who have taken some time to read would have realized that these districts account for nearly 4/5 or 80% of the active cases in the Union Territory. Similarly, 92 areas have been identified and designated as red zones in the Union Territory. 14 of these are in the Jammu division and 78 are in the Kashmir division. These red zones will be under stricter restrictions, restrictions on movement, extra surveillance and enhanced testing. We are acutely conscious of the fact that this is an inconvenient process and people in red zones, hotspots and containment areas do face restrictions and difficulties. We are grateful for the cooperation and willing support received from all sections of people. We assure you that the administration and the health department are doing all that they can that inconvenience to citizens is minimized. But I would like to request you for your continued support and cooperation in making our containment strategy a success. I would strongly urge everyone also to trust the judgment of the department whenever it comes to some zones being designated as red zones or containment zones. This is being done strictly as per the technical assessment and as per the probability of cases. So where are we on the overall COVID situation? Many of you may want to find out this. As I mentioned in one of my tweets yesterday, there is certainly a case for some reassurance and some respite, but no case for complacency. The daily positivity rate is showing a downward trend. The rate of doubling of positive cases has decidedly slowed down. In fact, the time it takes to double the cases in the Union Territory of Jammu and Kashmir is probably among the highest in the entire country. And I am sure many of you would have seen a report this morning which showed Jammu and Kashmir and Kerala as the two states or Union Territories which had succeeded in slowing down the spread of the virus. All this has been primarily made possible due to the cooperation of the people in enforcing a very, very effective lockdown, social and physical distancing measures, and proactive contact tracing, leading to early detection of cases, asymptomatic cases, and their isolation to arrest the transmission of the disease. The testing rate in Jammu and Kashmir currently stands at 703 per million, again one of the highest in the country. I am sure many of you would recall that when we had met you last time, around 10 to 12 days ago, the testing rate was 77.5 per million in Jammu and Kashmir. We have succeeded in ramping up the testing rate by almost 10 times. You are also aware that we were among the first in the country to have our own testing facilities. Since then, we have been continuously ramping up our facilities. When we started testing locally, our capacity was merely 50 tests a day. The number of samples tested yesterday was more than 700, and we are looking at achieving shortly a capacity of more than 1,000 tests per day in our 4 ICMR accredited labs. We are doing two things. We are enhancing the testing capacity of these labs. We are also trying to add more labs so that not only do we have more labs for testing, each of these labs is testing more samples per day. We are doing this through a variety of means. Getting more manpower, getting more machines, getting automatic machines, and ensuring that the supply chain of all the reagents required for testing is continuously maintained. In addition, we are also setting up, in fact we have set up, a decentralized sample collection in the districts so that the process, the time of collection of the samples, bringing them to the collection centers, bringing them to the testing centers is minimized.